Fractional technology has totally revolutionized the landscape of aesthetics. Laser resurfacing or resurfacing procedures in general were essentially all but dead. With the advent of a fractional energy delivery, we're able to keep recovery times shorter, safety profiles high, and produce clinical outcomes that were still quite reasonable.
What sets the E-Matrix apart from all the other fractionated devices is that it's sublative. Everything is happening below the surface of the skin.
The idea of sublative rejuvenation started with a very basic question. What could possibly be done by taking our bipolar RF delivery system and fractionating it?
What's unique about fractional bipolar radiofrequency treatment or sublative rejuvenation is that the distribution of the heat is mostly in the dermis. There's very little epidermal disruption.
The injury pattern to the skin is really top to bottom. At the surface of the skin, there's really only a pinpoint of damage, but there is a much larger area of tissue heating beneath.
We've known of these advantages of radiofrequency since the inception of Syneron. It's now time to take what we've learned and see if we can push the boundaries.
Our original perceptions of radiofrequency really had to do more with skin tightening.
RF can be incredibly versatile, can play some very important roles, everything from skin tightening to treatment of fat, body contouring, and now with a new form of resurfacing, sublative rejuvenation, I think it really is very, very interesting.
Radiofrequency has improved significantly. This is going to be revolutionary in terms of treatment of patients who need their collagen and their elastin stimulated and not have the post-op complications that we've seen with the more aggressive, ablative fractionated devices.
We can rejuvenate the skin surface, we can get the skin tightening, we can improve scars, so it's really a completely different scenario than traditional radiofrequency technology.
Patient response has been great. I've used this machine on a bunch of patients who have had a lot of other things in the past, especially my acne scar patients. Most of them have been really thrilled with this device.
After the advent of sublative rejuvenation, the challenge was thrown down by our physician partners to say, what else can you do? In the same way that sublative rejuvenation was focused on the most effective way of dermal rejuvenation, using the same unique pyramid-shaped injury pattern, the new tip focuses that on removing the maximum amount of surface irregularities. We can do all this without even needing to switch to a different energy source or laser. All you have to do is connect the new tip and the system will do the rest.
One of the things that really impressed me about the E-Matrix was its actual design. It's so easy to use.
Both energy and skin condition are monitored every millisecond. Never before has a technology provided so much feedback.
The reason we added sublative rejuvenation is that we wanted less downtime, we wanted more improvement clinically, and I think we've achieved that with E-Matrix.
There's some redness that lasts, and most of it's gone in an hour or two, and I've rarely seen it last longer. I've seen clinical results at a week. I'm not used to that.
During treatments with sublative rejuvenation, one thing I found very unique was not just the rejuvenating effects, the illuminating of the skin, tightening of pore size, and decrease of the rhytids, but I also found reduction of blood vessels.
The future for E-Matrix is just beginning.
Taking an aesthetic device and exploring treatment options for patients with medical skin disease.
I think it's very promising and I'm very excited about it.
It's truly a very exciting time for all of us here and everywhere in aesthetic medicine.